Staggered.
Nacional en México, en la Ciudad de México.
We're here in Mexico City. Let's begin with the daily press conference regarding the COVID situation, the COVID pandemic, which is caused by the new coronavirus SARS-CoV-2. They will be focusing on two main elements: the daily technical report, which will be presented by Dr. Alomia, and then Dr. Ricardo Cortés, who is General Director of the Promotion of Health, is going to be sharing a few things with us. You'll see. And then we'll open the Q&A period. Dr. Alomia, please. Good evening, everyone. Like every day, let's show the updated information regarding the international and the national context regarding the pandemic we are currently facing. First of all, let's look at the calendar. We are at day 46 of the National Safe Distance campaign. One more day or one day less, depending on how we look at it. We've had over 60 press conferences now, and thank you for your contributions to these daily conferences. Thank you, journalists, colleagues, and thanks to all the audience who's watching us from home. And thanks for helping us spreading all the relevant information regarding the prevention measures and the different mechanisms to take care of our health and to prevent the disease from spreading further. We take a look at the international data. We'll see that the active pandemic percentage, meaning the percentage of active cases, meaning the ones who have showed symptoms during the past 14 days, worldwide is at a 34%. So we continue to see a decrease in this trend. Worldwide we're looking at a 31%, and 34% is the representation of the European Union, which continues to go down, while the Americas are the ones with the highest percentage of representation of the active pandemic. We stand at a 51%, and there are also other regions throughout the world that have they all have the respective percentages of the active pandemic. So let's look at the national data. So far, the cumulative case number is 29,616 cases, confirmed cases in total since the pandemic started. But only one quarter, meaning 7,802, correspond with the active pandemic. The other 3 quarters are cases that have gone beyond the 14-day barrier, so they have been cataloged either as recovered cases or they showed complications and they have a different development. To this day, we have 18,812 suspect cases. We have 2,961 unfortunate deaths. We've had 68,783 negative results, and the number of People who have been tested is 117,211 people. Here we can take a look at the distribution of the burden of disease throughout the whole country, meaning how are these 29,616 cases distributed per state, and of course the states that have higher concentrations of the disease appear represented in orange or even dark red, which means the fact that a lot of states appear now in orange or red means that we continue to see an everyday increase in the burden of disease. Here we have the same information presented as a bar graph, so you can take a look at the total number per state, and we use the same color scale to represent the differences between states here, Mexico City being the one with the highest number of cases, of course. Now this is the active case distribution, and we can see, if we compare this map to the one that we showed yesterday and the ones that we have been showing during the past few days, we see that we have an increasing number of states that appear represented in either yellow or orange or even dark red, which means we've also seen an increase in the number of active cases. Here we have the same information presented as a bar graph, and this allows us to better appreciate what are the differences between states when it comes to the number of active confirmed cases. Here we have the active case incidence, cumulative incidence rate, which, remember, has to do with the population within each state. We're talking about the number of cases, of active confirmed cases, per 100,000 inhabitants per state. The national average is 6.1, and of course there is some variation among states. Next slide, please. Here we can appreciate the same distribution, but in the form of a bar graph, so you can better compare the numbers. Now here we have the fatality distribution organized per date of death, and like every day we have a fraction of the fatalities who are currently cataloged as suspect fatalities, meaning we're still waiting for the test results in order to either confirm or deny that they were caused by COVID-19. We have 245 suspect fatalities that are awaiting for the results. Here we have the same information presented as a bar graph, but organized by the state in which they occurred, in which they happened. And of course, Mexico City, Baja California, State of Mexico, and Sinaloa, the usual suspects, are leading the way in this chart as well. Here we have the general pandemic curve, and we are presenting both the confirmed cases and the suspect cases. We still observe an upward trend, an upward tendency. So this trend continues, and this is to be expected because several states within the country are just about to reach their pandemic peak. So remember, this is the curve that incorporates the totality of data nationwide. So it is only natural that it will continue to go up. Here we have the confirmed cumulative case number. So far we have 29,616, as we said, and we had an increase of 1,982 new cases in the past 24 hours, which accounts for 7.2% of the total number of cases, of confirmed cases. And of course, as we've said, even if the percentage remains the same, the number continues to increase because that percentage is representative of an ever-increasing number of total confirmed cases. Here we have the information regarding the hospital bed occupancy. We are relying on the IRAG network of hospitals who are notifying and updating their information regarding their admissions, their discharged patients, status of their patients, and their occupancy rates, of course. We had, in the past 24 hours, we had 652 hospitals who updated their information, which is 96% of the total number of hospitals. And these hospitals update this information every day through the platform that we have created to this end, and the ones in charge of presenting these reports and uploading them to the system have been assigned by the local authorities of each state and each locality. We have maintained more or less the same notification rate, and based on these notifications, we can state that we have currently 13,688 beds that are able to provide care for severe acute respiratory infection patients. And out of these total number of beds, we have an occupancy rate of 33% currently. So basically one-third of the special respiratory infection hospital beds is currently being used. Now, even though 33% is the occupancy rate nationwide on average, we see how there is great variation among states. Mexico City has a 70% occupancy rate, which is the highest in the country, and we have Baja California with a 60%, the state of Mexico 55, Quintana Roo 43, Campeche 41, and so on and so forth. This is an important statistic to monitor, because through the monitoring of these occupancy rates, we can contribute to have a better tracking of the development of the pandemic, and especially of those patients that are being hospitalized as suspects of COVID-19, regardless of whether they have been tested yet or not. Now here we have the ICU bed occupancy rates. Remember, the ICU beds are the ones who have ventilators, and they are used for patients in severe condition. We have an average occupancy rate of 27%, but of course there is great variation among different states. Mexico City stands at a 64% occupancy rate for ICU beds, and other states follow with similar occupancy rates all the way to the last states in the list that have very, very low occupancy rates. So we are keeping track of these states, and especially which states have over 20% occupancy rates to make sure we are utilizing our resources in an intelligent and efficient manner. So basically, we're looking at the data of all that was of the total data that was reported during 24-hour period. So that is the information up to now. And that is my presentation for today. Thank you. Thank you, Deputy Secretary. Good evening, everyone. Thanks to all of those people who are staying at home, who continue to stay at home. Friends, thank you very much. Today I'm going to be talking about citizen contact, so the different strategies that we have for communicating with the citizens, especially with those citizens who are staying at home. First of all, we have this platform, the website www.coronavirus.gov.mx, which since its launching date, which was quite a few weeks ago, has had interactions with over 16 million users, and has had a total number of over 33 million interactions. So 16 million users, 33 million interactions. And thank you to all of the civil society organizations, and especially the Institute for the Originary Peoples of Mexico, and all the different civil associations that work providing translation services into all the different indigenous languages that we have in this country, because that has allowed us to make this information even more available to a broader spectrum of citizens. Now, talking about the international comparison with Mexico, we've had most of the users of this website have been Mexican, and then a small percentage have also visited from the United States. Now here we have another resource, which is in that same website. We have the accurate data window. So basically, all of the numbers and all of the statistics that we present every day, and the ones that we don't present as well, they are available constantly, permanently, in their most updated version at this portal. Thank you to all of our data scientists and our teams who have been very active in analyzing and processing and presenting this information. According to the law, this information didn't have a unique ID number, but then we requested one to the relevant authorities, and unique ID number was granted to us. And basically this was to ensure the accuracy and that this data is fully reliable. Remember that this data that we present in this website are the data that the state authorities upload to the platform. So if there is some discrepancy or error or delay in that information that is being uploaded by the state authorities, and then this information is corrected by the same state authorities, for example, that they registered an outpatient as an inpatient, or they falsely reported by error a fatality or something like that, then there are mechanisms for them to rectify and to correct this data. So this is all to ensure that we as a civil society, you are as journalists, and also scientists and analysts have public access to all of these information, and they can use it the best in the way they best see fit. Now this portal, as we were saying, is an interactive portal in which you can zoom in to the map and display the specific information for each state and each municipality. If we zoom in, we will have access to more specific information. And we can also look at the data from other dates, from different days, ever since the pandemic started in the country. We've had an increasing number of people who visit this portal daily. And also I would like to point out that through this button you can download the file to keep it in your computer, and if you click on the HD map button, you can enter a higher resolution version of the map. You can also filter the results as to make specific comparisons between different states, and you can even export this information into a chart. Now, the Susana Safe Distance chatbot, who is available through WhatsApp, is still active. It has replied over 3 million messages. We continue to have a satisfaction rate of over 70%. And 164,072 people have chatted with Susana Safe Distance. If you take a picture of this QR code that appears on screen, it will take you directly to download the contact information of Susana Safe Distance. You can also input it manually by copying the number on the screen. Another way of citizen contact is through the different publications that we have on social media, especially these 6 main ones that have had an impact on over 20 million people, especially the presentation of the guide for the protection of health in the case of persons with disability. That was a huge success. But also the daily press conferences have had a huge number of interactions and a great amount of interest shown by the population and by the public. And making these conferences available online through the official social media platforms allows us to reach those people who do not necessarily can watch the conferences live, but then they can watch them whenever they have time to do so. Also, we have the app COVID-19 MX, which is available to download in iPhone devices, in Android devices, and in Windows devices. We've had, in Harmony, in iOS, and in Android. These 3 operative systems are the ones who support the app. And we've seen how 30% of the people who have accessed this app have done so in order to better understand what are the vulnerable groups. And 30% of these users have obesity. This is very similar to the results of the National Nutrition Poll, which throws similar percentages for obesity in our country. Also, out of the users, 13% have high blood pressure, 7.8% are diabetic, and a little bit more than 1% are pregnant women. Finally, one of the first methods that we used to contact and communicate with the citizens was the phone lines, or the hotlines, the phone assistance services. Through the number 800-0044-800. And here we have the information. Over 6,000 people have been oriented, answering their basic doubts regarding COVID. We have also a number for people who hung up after calling. Out of the total number of people who called, which is over 80% calls, we had over 23,000 calls that hung up after calling. And it is important to say this because this comes to a cost. All of these services are paid by the taxes of all of us. So we shouldn't be wasting people's money. Very important that you continue calling. But if you call this line, please stay in line, and please do so if you have a reason to do so. You can report the case, you can ask for information, and depending on your specific necessities, you will be redirected to a specific area that can provide the best orientation and the best attention to you. So, for example, the over 6,000 people who called for general information regarding COVID, this is information that they could have easily accessed through the internet. But in this case, in the case of the people who called asking for general information, it is very likely that they weren't able to access an internet connection, or that they had some sort of disability or any other condition that prevented them from directly searching online. We also had an important number of people who reported having severe symptoms through the phone, and they were redirected to an emergency hotline. We're talking about over 4,000 people, and over 6,000 people reported having some sort of emotional distress, and they were redirected to a mental health specialized unit, in which we've been providing care 24/7 for everyone who needs it. We are painfully aware of the consequences that this National Safe Distance campaign has had on the Mexican families. So we make these services available, so if you have any sort of mental health related issue, you can get proper attention. Thank you, Dr. Ricardo Cortés. Before we start with the Q&A, let me just give two messages related to the presentations. One of them is, as Dr. Ricardo Cortés, we are dealing with a full repertoire of different tools that allow us to be in contact and in communication with the citizens, so we can accompany them throughout this whole process. During a crisis like this, it is more than natural that to have all sorts of unexpected feelings and emotions and situations, and that is why one of the focus points of the federal government is to provide reliable and easily accessible information to all citizens. We are currently in phase 3. As we have said before, phase 3 is a phase that is characterized by a very high speed regarding the transmission rate and regarding the development of the disease in those people who get infected. So, people who get infected might need urgent medical care or immediate medical orientation. And that is why we have these hotlines that are available. If you have any doubts of what you should do regarding yourself or some relative or some friend, and if you're not being able to find the specific number, call 911. If you don't know what to do, if you don't know who to call 911. This is a perfectly valid option for you. And we will be presenting additional information about a new tool of communication that we'll be presenting to the public, and this will be presented to you very soon, in a few days. Also, talking about the daily technical report, let me emphasize where we are and what are we expecting for the following days. We are in phase 3, and let me sum up what has happened since January the 28th. We first had a change in the occurrence rate, meaning in the beginning we didn't have any cases, but we started implementing the surveillance system. Before we had any confirmed cases, we started monitoring suspect cases, and thanks to that we were able to timely detect the first case and confirm it. Then, after the first case, we started implementing the proper measures, and when we saw a turning point that indicated that we were about to enter phase 2, and we also modified the strategy, and we started implementing measures that were not addressed at the individual but at the structural factors that control urban mobility levels, for example. So this is what we usually call massive mitigation measures. Now, does the fact that we adopted massive mitigation measures mean that we stopped tracking individual cases? No. We continue to do both, but the focus changed. So, and you all are witnesses to this, because when we were already in phase 2, you remember in one of these conferences there was one confirmed case that attended the conference, and then we did the tracking of all the contacts of this person and their step-by-step journey during the past few days. So we continue to do the tracking of cases, specific cases that merit it, but the focus on phase 2 was on the massive mitigation measures. Now we are in phase 3, and we have also changed the focus of the vigilance system. Now the focus of the vigilance system, of the surveillance system, is on the hospital surveillance, and we are doing this through mathematical models that have been provided to us from very specialized professionals that have been coordinated by CONACYT, by the National Institution for Science and Technology. Now, what does flattening the curve mean? To flatten the curve doesn't mean that the curve is flat, just like this table. If the curve were flat, then we wouldn't have a pandemic. And that means we would have the same number of cases than the day before. But that is not the way pandemics work, or epidemics for that matter. The way pandemics work is we have an gradual increase in the number of daily confirmed cases, increase, and then eventually we peak and we start going down. So we are still going up. according to our predictions, we are reaching the peak somewhere between the 6th and the 8th of May. So to start going down means that the number of cases that will be presented the day after will be lower than the day before. So when we say flatten the curve, we don't mean that the curve is flat. What we mean when we say we are flattening the curve is that in comparison to what would have happened should we have not implemented the massive mitigation measures, then we would have had a very, very, very high curve. If we didn't implement any measures, we would have had a curve like this, which is obviously sharper than a curve like this. So we say this curve is flatter than this curve. Okay? And finally, a very interesting characteristic of infectious disease that have an epidemiological interest is that they present an exponential growth. And this means that the number of cases that are presented that occur the day after and the day after and the day after is higher than the one of the day before, but not in a linear fashion. Yeah? It's not like it's 2 more and 2 more and 2 more, or 300 more and 300 more and 300 more. Means that it's a percentage, it's a proportion that is the number is higher by a proportion, not by a set number. This was defined since the 18th century, and the famous Thomas Malthus, which we all know, he defined the law of Malthus in a very, very famous book called the law of populations. So he described this exponential projection, also called geometric projection, which basically means that, let's say we have a couple here. It's 2 of them, and then they procreate more than 1 child, more than 2 children. Now they have 3 children. So 3 is more than 2. If that happens on a population scale, then the next generation will be, of course, larger than the one before. So it's not like humans are being replaced one by one, but the populations are growing. So the same thing happens with infectious diseases. One person produces more than 1 case. It doesn't infect just 1 people. Most probably it infects 2 or 3 people. Or SARS, or the new coronavirus SARS-CoV-2, most probably the number is between 2 and 3. But what this means is the number will, of course, grow. It continues to grow and grow and grow and grow. So then we have this exponential curve. So of course, the speed in which we start to see a larger number of cases gets faster and faster. So for example, maybe we took 20 days to have the first 10 cases, and then it only takes us 10 days to have 10 cases, then only 5 days, then only 1 day, then only half a day. Right? So this is interesting. Okay, let's start with the Q&A period.
Muchas gracias, Secretary.
Thank you very much, Deputy Secretary. Nurit Martínez from El Sol de Mexico. Oh, I wanted to talk to Alcocer. He's not here. My question for you is, specialists and former public servants have talked about how this pandemic has been managed. My first question, if you would let me have a few. Yes, please, just remember there are other people. Oh, yes, please, I hope my colleagues will understand. My first question is this. The specialists are saying that we're missing leadership in terms of how this pandemic is managed. And I would like to ask your opinion on this. It seems like it's not clear how things are being managed. It seems that there are a number of states such as Durango, Michoacan, and Tamaulipas who have taken their own measures, have implemented their own measures. I understand that you have had some friction with the governor of Jalisco. Now, with how this has been managed, it seems that you also don't have the 4 C's: clarity, consistency, concision, and trustworthiness. Well, I hear a lot of opinions. I'm not sure if that's a question. Your opinion is valid. There are preferences, there are styles. Here we're working here, we're talking about a technical message, we're talking about science. That doesn't mean that people can't opine. For example, maybe somebody doesn't like the work of Siqueiros. I mean, if you want to opine, go right ahead. This is a free country. We always must remember about the freedom of expression and the media. We're celebrating them on Sunday. So, okay. So you don't care that people don't believe you? Everyone can opine. Of course. But people have been speaking, especially the ex-Secretary of Health, Frank Narro. They have said that there just is no way to believe you. I respect them very much. I'm so glad to hear their opinion. I'm glad that they're active, just like any citizen. Everyone has the right to opine. I'm not clear if when you're talking about confrontation with the governors, is that your opinion or your publisher's opinion? From El Sol de Mexico. Is that their opinion or no? Every opinion is valid. No, I mean the secretaries, the health secretaries from those states, they've had numerous meetings and they're having another one tomorrow. For example, in Tamaulipas, they were talking about how the information is inconsistent. They're saying that the numbers are double what you're saying. What do you say to that? Well, I say, great, that they have an opinion, but what is the question? Oh, so I should give you my opinion that the governor of the Secretary of Health of Tamaulipas has an opinion? I think that's great. If you don't have any more questions, no, you're not seeing or hearing. I'm sorry, I'm not clear if you're here to ask questions. It's a question. Aren't you interested in this criticism? Let me see here. Let me be. But let me tell you, welcome, freedom of expression, opinions. You. Thank you. Good evening, Poncho Gutierrez. Now, authorities in Japan have just authorized a use of an antiviral. I'm going to read this because I don't want to say it wrong. Remdesivir. Now, the Mexican health authorities, are they thinking about using this in the future? And then a question for Dr. Alomia. There are people, the majority of cases of unfortunate deaths from COVID-19, they usually have a chronic disease. We saw last week that there was a very small percentage, maybe 1 or 2%. These are of people who had died, unfortunately, but did not have any chronic diseases. But then when they died, they saw that they did have diseases. So how many cases are there of people who did not have any chronic diseases, who were totally healthy and who died from COVID? How many? Oh, remdesivir. This is an antiviral drug. It's one of few that people have been doing clinical and research on to see how useful it could be for treating COVID. Recently in the United States, Dr. Tony Fauci presented the results, the preliminary results for the clinical trial that was carried out, and Mexico participated in that. And the results, we could qualify them in qualitative results. We could qualify them in saying that they're promising because they showed a reduction in how long COVID lasted in moderate and light cases. Unfortunately, this study was not aimed at showing efficacy in serious cases. We are having some ethical issues there at the moment. But we have great expectations for this product because many are being studied. So perhaps this could be a treatment, and that would be great. Dr. Alumia? Yes. In fact, in the records, we were talking about this last time, when we notify of how many cases there are, or when we do an interview directly with patients, with the doctor, with the epidemiologist, that they do these interviews with the patients directly. There are studies that over how the virus has evolved, they see that there are comorbidity issues. So this speaks to the fact that the person didn't declare that. There is an interview that is based on an epidemiological study, and they talk about all the risk factors that are in the epidemiological study. And if the person says no to everything, that's what is recorded. Now, there was a percentage that perhaps at the beginning was 2% of the deaths that had been registered. And we did definitely see an increase there. By the last cutoff date, it was between 4 and 5. Nevertheless, we have to consider one point always. If we talk about that percentage of 4, 5, and we follow along with that for people who did not declare their background issues, background diseases or sicknesses, maybe they weren't aware of them. So at that moment, that's when we would do an investigation into their clinical file. And because people who are hospitalized also go through other laboratory tests, which could show that they have a high blood sugar level or they're pre-diabetic, and maybe that person didn't know that. Or maybe when they get their pressure taken, they have their pressure taken, that they identify that they do have high blood pressure at that moment, and they didn't know that. So we then at that point would investigate and look into that even further. But if there were people who did not have any risk factors in that group, we might think perhaps they had immunodeficiency, or perhaps that was from some sort of treatment that they were under and that they hadn't identified that. So to give you that information, we really would have to investigate much deeper into his background and into their clinical file in order to give you a number that faithfully expresses that percentage and tells you that they didn't have any other risk factors. Yes, and to complement that, Dr. Alomia, we do have that sector of the population that does not have risk factors, who are not over 60 years of age, who are not pregnant. Those people are of special interest for us to understand the pathology of this disease. There are many questions, many scientific questions that we still don't have answers to. So we want to analyze these people who very unfortunately did lose their lives with people who did get the disease and recovered. So it's important to understand this phenomenon progressively, this health phenomenon. Thank you. You.
Gracias, doctor.
Thank you, doctor.
Buenas noches a su equipo.
Good evening. Good evening to
Víctor,
your
buen día
team.
para Víctor
Victor,
Vlogs y
buen
México Informa
dia.
de YouTube, doctor.
And I
Le traigo una
also have news
pregunta
on YouTube.
un poquito
I have a
adelantada. No sé si sea
question a
adelantada,
little bit maybe futuristic,
obviamente
a little
es
bit
relacionada con el
related
regreso a
to
clases.
people going back to school.
De las 45,000
Of the
instituciones que existen en el país, el
45,000
30%
institutions
no
that
cuenta con
exist in
agua.
Mexico, 30% don't
¿Qué
have
protocolos
water.
van a implementar
So,
ustedes
what
junto con
protocols
la
would
Secretaría de
be
Educación
implemented
Pública
along with the
para
Secretary
que
of
se les
Public
brinde la
Education,
seguridad a los
the
estudiantes
Ministry of Public
y,
Education,
y al
so
personal
that you would be
educativo
able
que labora
to
en
deal
estas
with
instituciones?
this?
El día de hoy,
Especially for people who
casualmente me
work at
encontré
these
un video
institutions, they need water.
del
I also
protocolo de
found
cómo
a
se lleva en
video
China,
on protocols that's
cómo se
going on in
recibe
China right
a un
now,
alumno.
how they
Y
are
pues la verdad a mí
receiving
sí se me hizo un poquito
children
interesante
back to school.
cómo
And, I thought it
llega
was
el
interesting
niño a la escuela, cómo lo
how
reciben,
children arrive
¿sí?
to
Cómo lo
school,
recibe el personal de la
how
escuela,
the
cómo ingresa a la
educational
escuela
personnel receive them to school, how they
y
go into
obviamente pues el
school,
protocolo de
and
sanitización, perdón,
what the
si
health
no dije bien
product protocol is
perdón,
there.
una disculpa.
I'm sorry for
Entonces,
not being able to say that word
esta
well.
situación yo se las quería, pues,
So I
externar,
wanted
¿no? No sé si
to
ya
ask you
ustedes
about
van
this
a
situation.
realizar una
Are
implementación
you going to
de
carry
cómo se va a
out
recibir
some sort
a
of a
los alumnos
protocol
o
for
cómo lo
how
van a
children are
implementar.
going to
Esa
receive
sería
back to
mi pregunta.
school?
Muchísimas gracias.
That's my question.
Sí, su
Thank you.
pregunta es muy
Yes,
útil y no
Victor.
es nada
Good
adelantada. Siempre hay
question,
que
Victor. No,
adelantarse a las
that's not too
circunstancias. En
far
nuestro
ahead
caso
in the
hemos visto
future.
toda esta
We all
epidemia,
have to
nos adelantamos a
think
la
about the
fase,
future.
bueno, nos
I mean,
adelantamos con el
even with
alertamiento
this
temprano
pandemic,
el
first
3
we
de
were in
enero, a
phase
la fase
one
de
and we were
preparación, nos
thinking about
adelantamos a
phase
la fase
two.
1, a la fase
And
2
then we got
y a la
ahead of
fase
us. We
3
went
y ahora
into the
naturalmente
future
nos
and
estamos
talked about what was
adelantando
going to
a los
happen in phase
escenarios
three. So now we're
de lo
talking
que
about what could
técnicamente llamamos
happen in the
desconfinamiento,
future
el regreso a
for
la
deconfinement,
nueva normalidad.
for
Y esto
going
es lo
back
primero
to
que
our
quiero
new normal.
destacar.
And
COVID
that's the
es
first thing
una
that I want to highlight.
enfermedad emergente, es una
COVID
pandemia
is an
que nos
emerging
impone
disease.
a
It's a
todo el mundo un
pandemic
reto nuevo
that
que
is putting a
consiste
huge
en
challenge at the feet of
replantear la nueva
everyone in the
normalidad.
world. We have to talk
Hay
about the new
muchos
normal that we're
elementos
going to
todavía
be
por
living
definir,
under, the new
no
world
solamente de
order.
lo que hacen los gobiernos, sino de cómo se va a
Not
comportar la
we
enfermedad.
we we,
Hace unos
we have
pocos
to
días en
talk
una
about not
entrevista
just what the
que
government's going
le
to do, but
hicieron,
how the
mencioné
disease
algo
is
que
going to
aquí he mencionado
behave.
varias veces.
We've mentioned
No hay
numerous
ninguna
times
garantía
here
de
that
que
there
los
is
países
no
no puedan tener
guarantee
un retorno
that
de la enfermedad.
countries will
¿Por qué
not be able
razón?
to
Porque en la
have
medida
a
en que hay
return of this
enfermedad,
disease,
infecciones,
another
contagios en
outbreak,
el resto del mundo,
because when
siempre
infectious
puede
disease,
regresar a
the
un
whole
país,
world can come
excepto que
back to a
alcancemos un
country,
elemento
except
que técnicamente se llama
if
inmunidad de rebaño, que aquí
we
también le hemos comentado.
except
Inmunidad de
if we get
rebaño es un
herd
fenómeno
immunity, which
en
we
el que
have
se alcanza
talked about here
una
before.
proporción
Herd immunity is when
fundamental de
an
personas
important, a significant part of the
necesarias para que la
population
eficiencia de los contagios ya no sea
are
la que
immune to the
permite que haya
disease
una
so that
epidemia y entonces se
contagion does
mantenga
not
la epidemia
spread as fast, so the
controlada y finalmente
pandemic is
desaparece.
controlled and then later
Interesantemente, esta inmunidad de
disappears.
rebaño quiere decir
Interestingly
que no
enough,
se
that
necesita que
herd
todas las personas
immunity
de un país
doesn't
sean
for
inmunes,
everyone to
basta
be
una
immune.
proporción.
We just
Cuando las
need a
enfermedades son
certain
muy
proportion,
transmisibles,
a
que es
certain
el caso de COVID,
percentage.
ya
When
dije
we're
que el
talking
número
about
básico de reproducción
transmissible
es alrededor
diseases,
de
which is
2.5 a
COVID, and this
2.6
one we're
o
talking
7,
about
según
percentages
distintas
between
estimaciones.
0.6
Se
to
necesita
2.7%,
aproximadamente
depending on who you're
60,
talking about.
65%
That means that we
de
would
la población
60 to
que haya sido
65%
inmune.
of the population to be
Ahora, un
immune.
elemento esperanzador en México
A
y en el mundo es
hopeful
que
thing is that in
tenemos muy
Mexico and in the
probablemente
world,
una
we
proporción muy importante
probably,
de
very
personas
probably, have an
asintomáticas
important
que se
percentage of people
infectan,
who are asymptomatic, who have
deseablemente
gotten
desarrollarán inmunidad.
infected,
Cuando uso la
and
palabra
then
deseable
develop
es porque también hemos
immunity. When I
comentado
say
aquí
we hope they
varias
have,
veces de que
because
aún
we've
no
used
existe
that word
toda
here
la
before,
certidumbre
because
científica de
we
que la
don't
inmunidad va a
have
ser
scientific
efectiva,
certainty that
protectora,
immunity will
etcétera.
be
Pero
effective
asumiendo
and
que así
protect
sea,
people.
en
But
la medida en que haya
assuming that it
muchas
does,
personas infectadas, también
and
muchos
assuming that
casos,
there are many people
también
who are
esto es
infected
algo que
and many
comentamos casi cada
cases,
día,
and
tenemos
we
una gran
talk about
cantidad
this
de casos,
basically
lo
every
sabemos muy
day,
bien,
we
de
have a
casos con
large number
síntomas
of
leves a
cases
quienes
with
les hemos
light
pedido quédate en
symptoms.
casa,
And so that's why we've asked you
quédate en
to
casa.
stay at home.
No
Stay at
necesitamos que
home.
estén en los
Don't
consultorios
need
ni en
you
las
to
salas de espera,
be at
porque eso lo que
clinics
va a
or in
hacer
waiting
es que
rooms,
sean fuentes
because
de
what's
contagio.
that going to do is
Entonces,
make
desde
you a
que empezó
source
la
of
fase
infection.
2, ¿se acordarán?
So since
Dijimos,
phase 2
quédate en
started, do you
casa
remember
y
we
es
said stay
también las
home,
personas con
and we
síntomas
said
leves
said for people with light symptoms, if you have a low risk of complications, stay at home. How many people are these? Hundreds of thousands of people. I wish it were, wish it were, God willing, it were millions, because that is what's going to stop this pandemic. Many people who are infected, who have light symptoms or moderate symptoms, long as they're not severe symptoms, and we've said here numerous times as well, 100% of people who have risk factors or who do show symptoms, they should go to the hospital. And 100% of those should be counted by the monitoring that we have talked about. That's the general context. But then there's a scenario for a return. Up to now, Susanna Safe Distance, the campaign is programmed to end on May 30th. And we're programming and we're thinking about what would be the deconfinement measures naturally at that point. And please, this does not mean that everyone is going to be in the same normal. It's going to be staggered. There are going to be numerous metropolitan areas in many places that are slowly going to be staggered in an ascending manner. We had to say we have to prepare for a long pandemic, and that is true now. I'm being consistent. This is consistently what we present every afternoon. We are prepared for a long pandemic. We see it spotty at first. We have Mexico City basically at the top, at the peak, at the apex. Also, Cancun, they're close to their apex as well. But then there are other cities that are starting to go up. Their transmission rates are starting to increase. In terms of deconfinement, it's not just schools, it's work, it's the public, it's being in public, etc. And we have a work group, specifically the Secretary of the Economy, the Secretary of Labor, the Minister of Foreign Affairs Abroad, Moctezuma Barragan, the Mexican Social Security Institute, and we have all had many meetings. Today we had numerous meetings talking about this, and we are working on programming that deconfinement time. We have time for one quick question. You back there behind Natalia Vitela. Hello, good evening. Yes. Andrew Aguilar from Pie de Página. Today we wrote an article, the place where at the supermarket supply center, and we wrote about how there was an increased contagion there, but they weren't willing to close down the market. Is it possible with the Secretary of the Economy or with authorities in Mexico City, could you put special emphasis on SEDA because of how they supply the whole Valley of Mexico? Because I think we need some more attention on there, because these warehouses, they should be closed, right? Thank you. We don't really have too much time. We only have 2 minutes, but let me again explain to you about testing. I don't know, for some reason or another, there's a barrier for people to be able to visualize the tests issue. I want to make this clear right now. We have identified that there are private laboratories that are offering serological tests for IgG. We've found 2, and we talked with COFEPRIS to see if they had the necessary permits. And it's a bit worrisome because it's the same thing that we've seen in many people, not in all, but in many people who get together and talk about testing, and they are interested in making money off of it. Specialized attention is there. It's been there for numerous days. Those are the actions. Many people had heard about them all over Mexico City. They even had some big posters where they had written this information there, and some people were really turned off by that at the supply center, because prominently they had these posters there saying health risk. Then we have a structured operation that has been in place for a couple of days. These people are responsible, as well as with the secretary, the federal health secretary, they're responsible. But back to the testing. matter, which was your question, this depends on a strong epidemiological study. If we're doing testing and it doesn't have an epidemiological monitoring objective or point, then that's not going to help us. We presented on our we presented on our technical guide for monitoring and our laboratory guide. We published that here. We showed where they have Centers for Disease Control in the United States. They have sentinel surveillance over there. We have it here. They have its asymptomatic cases. There's a usefulness in terms of really severe cases. But I think that tomorrow we'll have time to explain this matter of testing again tomorrow for anyone who wants to update on that. But just so that we leave no stone unturned, there is a place where you can get testing, and we're having a special operation there, which is controlled epidemiological monitoring and prevention by the City of Mexico, supported by the federal government. Thank you. It's 8 o'clock on the dot. See you tomorrow. Thank you.